So, Rachel, thanks so much for inviting me to come and talk this morning to the Analyst Network. My name's Kevin Dunn. I'm the HDR UK Midlands Programme Manager. So I manage the regional network for HDR UK. I'm employed through the University of Birmingham and I have a honorary contract with UHB. I wanted to probably kick off with just a bit about me. So I started in the NHS in the late 90s as a YTS. They call them apprenticeships these days, but I was doing business admin. And that's where I first got into databases, really, because we were using a GP access database to find GPs across Wolverhampton, and also PMS, what it was called then. It got replaced by PAS, but that was the patient management system. So all the patient data is in there for appointments, etc. I got employed as a clerk, a data clerk on the dialysis unit. So I was on the hemodialysis unit. The nurses were seeing the patients and I was putting the data on the computer. So they were filling out a paper flow chart and I was passing it to me and then I was putting all that data on the computer. I then took a role with the Black Country Cancer Research Network as a data manager. So here it was led by Wolverhampton, but I was out at Russell's Hall in Dudley, Kidderminster, Stafford and Walsall. We were collecting data from patients who were recruited into cancer trials. So that was the first kind of getting into research data. And then I took a cancer information officer role. So I was actually with Tom Gemma, who's on the call, monitoring cancer weights and introduced to cancer minimum data sets, national audits, learning about coding, how to transfer data from us to DH. And also data sharing, because we started to do MDTs, regional MDTs. So it was setting up those MDTs, sharing images, pathology, etc. Around the region. I then got into R&D, started linking data between research patients and the other clinical systems across the trust so that we could track and screen patients. Then I took on a job head of R&D at the orthopaedic hospital. Again, still doing stuff with data, developed a database, national cancer data, and then took a regional role with the IHSN, which is now called the Health Innovation Network. They're about taking ideas from staff across the NHS and trying to commercialise them, working with industry, so local SMEs, etc., before jumping over to the University of Birmingham to take on this new role of regional manager for the network. And I guess I don't work with patient level data anymore. We develop a network and the kind of things we do now is more operational data, but also things like SharePoint and collaboration. So that's my world of data these days. So I joined the NHS in a very different time. It was very paper, very manual. As you can see, a lot of you will remember these things, phones, fax machines. I started off opening post and date stamping it and logging it in a book, thinking, why the hell are we logging our post in a book? And I think it's because if somebody says, I sent you a letter back in October and you haven't replied, we could check the book to see if it was ever received. But yeah, we had over projectors, which is how we used to do presentations, and we had lots of notes. And I don't know if you've ever worked in health records like I have, but you used to get kind of squashed in those big notes. And if somebody wanted to get patient beginning with Williams, like you'd have to wait till they get out so they could get in. Very different. And lab results, I used to sort them manually with a thimble. So I used to have thousands of lab results on my desk and I had to sort them into piles. I mean, this is how the NHS has moved on. And this is what our computer screens look like, as you can remember, some of you. Some of you probably never seen what this is. And when our computer screens look like this, I actually look like this. So this is what the NHS does to you. So HDR UK, what is it? What's it all about? So it stands for Health Data Research UK. It was set up in 2018 and it was funded by 9 different funders. And those are all listed there. The idea of HDR UK was to originally set up or fund regional sites to work together within that region. So it was an open competition. Regions had to bid to become a site. So the Midlands led a bid through the University of Birmingham and it had 4 academic partners. So that was Birmingham, Leicester, Nottingham and Warwick, and 1 NHS trust, which was UHB in Birmingham. So we applied for £3.5 million to set up the regional network, and it was really an academic collaboration in the beginning. where we looked at how could we potentially link data across the region. That was the kind of plan. And also we had how could we use AI, for example? How could we use machine learning to help and assist clinical decision making? So that was the kind of plan, was to link the data across the region, and how can we develop tools that will help clinical delivery of service. The other centres that were funded were Wales and Northern Ireland together, Midlands, Scotland as a country, London, and then Oxford and Cambridge, so the Golden Triangle, as they call it. So originally back in 2018, we had a lead in each area. So it was headed up by Simon Ball, who's a nephrologist in Birmingham. Tony Brooks is a geneticist in Leicester. George Kutos, he manages a team of AI specialists. So he's a bioinformatician in Birmingham. Phil Quinlan, he does a lot on infrastructure and linking data and federated analytics. He's in Nottingham. Theo used to be in Warwick, but he's now in Birmingham. And Keith used to be in Warwick, but he used to be in Leicester, but now he's now in Warwick. And they employed me to try and help these academics come together and work together to kind of establish this partnership between the different providers. And the other centres, what HDR UK nationally wanted us to do is, because they realised there were great stuff happening across different parts of the country, they wanted us to all come together and see how we could work together nationally. So how can we all kind of breathe the same air? Because they saw that there was really good things happening, but they thought if we could try and bring people together, we could do more and we'd be more impactful. So that was the kind of original idea. Each region had a director, and each director was given a theme, a kind of a topic to focus on. And we in the Midlands, we were given the better care theme to lead on. So there's other things like understanding causes of disease, the human phenome, clinical trials, public health, applied analytics. We were very much at the patient interface. So how can you use data to improve care? What is it that you can do with data that can actually transform the NHS? So we were definitely at the kind of bedside part of this journey, this data journey. Then came these health data research hubs. So they were funded, and they were projects trying to link data together around a particular disease site. So you've got Breathe, which is all about respiratory data, DataCan, which is about cancer data. We led on two hubs from the Midlands. So one was called Insight, which is ophthalmology data, and the other one was Pioneer, which was acute care data. So this is where we're trying to link data together around these kind of disease areas, and then make it usable for research. And in the better care thing, HDR UK didn't kind of have national coverage. So the north of England wasn't represented because, you had Scotland, Oxford, London, Cambridge, Wales and Midlands, but the north of England, it wasn't part of this journey. Neither was the southwest. But obviously the north and the southwest are really important. They've got patients, they've got data, they've got trusts. So they created two new sites, which was the north and the southwest. And we, the Midlands and the north and the southwest, became the kind of better care partnership. So we were leading on that better care theme. And this kind of happened around COVID, that these were funded. So we did a lot of stuff online. And it was about how could we work together and learn from each other as three regions about using data to improve care. And we did projects such as, there's you can't see on this slide the title's changed, but there's a condition called hypertrophic cardiomyopathy. And this is where people just collapse. You see like footballers and they just collapse on the pitch on a Saturday afternoon and they're like completely healthy. Well, often they have this underlying heart condition called hypertrophic cardiomyopathy, and it's this unexplained thickening of the heart, and it's an inherited condition that affects 1 in 500 people. And the kind of risk area is it can be quite severe or it can be quite mild, but what we're trying to do is to develop a risk stratification model around this disease, to then group patients into low risk, medium risk, high risk, so that we don't treat them all the same. So low risk patients you might be able to see less frequently in clinic, and you might be able to treat them differently with medication, for example. Or you could have patients that are quite severe and you need to see them more often, and so we were trying to kind of change the way that we were treating this big group of patients based on their risk score. And that was a project that we were doing in Birmingham. The plan was then is once you've done it with the actual cohort, so the people that have got hypertrophic cardiomyopathy, could you run that same algorithm across the whole electronic health record? So could you potentially identify people undiagnosed with hypertrophic cardiomyopathy? So these people that have got the condition that have never been diagnosed. So actually then you're changing the way that the NHS is really operating. So it's more about understanding who might have it and then reaching out to them before actually you leave that condition to get worse and then they rock up at A&E, for example. So it was kind of transforming the way that we were operating as a health system. So we kind of come to the end of our first 5 years in 2023, and then we got funded for another 5 years. So our funding runs through to 2028 at the moment. It's HDR UK area for the long game. I know you've probably seen different projects popping up at different times around data and infrastructure around the NHS or from DH. I guess the good thing about HDR UK is it's backed by a lot of research funders, in the sense that these individual funders would have funded individual projects around data. So, how could you collect a lot of data around diabetes, for example? But it's really about how could we transform this as a whole system. So how could you kind of bring data together across the whole system and let researchers and analysts access that data for discovery for whatever condition? So that's why it's kind of got that kind of long-term vision and longer-term funding from these funders. If we look at the macro level, there's a lot of things at play here. Global population is growing. Waiting lists have been probably the longest or the worst that they ever have been. We've got huge disparity in inequality and health inequalities across the nation. And then obviously we've got opportunities with technology that we never had before, such as supercomputing, etc. So these are some of the kind of driving forces behind what's happening. And then recently we've had the Sudlow review. I don't know if anybody's seen this published. And it's really, Kathy used to lead the HDR Scotland sort of regional network before setting up the BHF Data Science Centre for HDR UK, but she led a review through for the government to look at data across the system and, what's the current state of play and where's it heading and where's it going and what are some of the opportunities and what are the challenges. And I think some of the key points that came out of this review was that health data is used safely every day to improve people's lives. And patients and public are generally quite supportive of their data being used to improve their lives and the lives of others. The other thing it said is that there's a huge amount of data sources across the whole system and beyond. So, the data's there, it's how can we really kind of try and pull it together? But the way that we get transformational understanding and insight is from linking different data sources together. It's not just looking at one particular data set, but how can we bring data around a whole person? But there's obviously many obstacles and delays to doing this, and you guys will understand this. I mean, some of you will have access to patient level data routinely as part of your normal job, but sometimes when you're trying to link that with other data sets, like for like across the country, you may run into obstacles yourself. So there's many obstacles and there's many barriers, and fundamentally the delay in not letting you guys as analysts and researchers access to this data is affecting millions of people every day. I mean, that's the problem, and we need to recognise that health data is a critical national infrastructure, and it needs proper investment and it needs sorting out. So from the report, obviously, some of the issues, there's a number of recommendations, and a lot of this is what we've been trying to do for forever, really, which is improve access, speed up access, making sure everybody's using the same kind of standards and coding. So none of this really is new. I mean, it's all the stuff that we know generally with what the problems are with data and how it's how it's spread across the system. So HDR UK, well, what are we trying to do? We're trying to link data across the whole of the UK. So it's not regional wide, it's across the whole nation, you know, all four nations of the UK. And we want to collect the NHS nationally collected data and link that with regionally quite powerful data that they've got in the electronic health records, for example. And then health related data, so ONS and SAIL and RDS, etc. But imagine if you could link this with personal monitoring data. So, you know, your Fitbits and your iPhones and your behavioral data, such as club cards, spending data, and link this with environmental data and research generated data sets such as UK Biobank. If you could link all this data together, imagine what we could do. Imagine if we could allow you guys as analysts access to this all this data. Imagine what sort of discoveries you guys could find. You know, we could link pollution with asthma, and we could start to, you know, map that out and look at it. This the possibilities are endless. I think that's what I'm trying to say. So we've got what they call infrastructure pillars. So there's a big piece trying to look at the tech, as in, you know, do you put all the data in the cloud? Do you leave it where it is and make it findable? How do you link it together? So there's that whole piece on that whole techie part of the infrastructure and the architecture of data and how it's stored. There's a massive piece on trust and transparency. Obviously, you know, we're custodians of patient data here. So it's how can we take the public and the patients on board with us and get them to get behind us and let's be open and let's be transparent about what data is used for. There's many misconceptions out there, and there's, you know, there's campaigns such as Data Saves Lives and Use My Data that are really trying to push this movement and get public and patient behind it. Interestingly, I think you'll remember that kind of with COVID and Chris Whitty standing up doing a government briefing every day, people kind of understood more about research, more about health data and why health data is really important. I think we had a lot of the general public on board and they'd had an understanding of where we're all trying to head with this. But I think since COVID, we've probably gone backwards a little bit, if I'm honest. Usable data. So, you know, how can we make sure that the right people have got the right access at the right time to answer those important questions that we're all trying to answer? And how can we bring down some of the barriers? How can we speed up access? That's the key thing around there. And then obviously capacity building. How do you develop the analysts for the future? You know, sometimes I don't know if any of you are involved in recruitment, but sometimes it's really difficult to recruit people into roles. And it's, you know, how could we start looking at that whole thing around building capacity around that kind of data. Then we've got these big driver programs. So these are big research programs around particular areas. So, for example, medicines, huge burden on the NHS. You know, the inappropriate use of medicines, etc., polypharmacy, etc. You know, how can we improve the way that medicines are prescribed and used through data? I mean, that's one thing that we're trying to do. Pandemics and outbreaks. Obviously, we've had one pandemic. How could we be better prepared for a different one, etc. So those are some of the big driver programs that are, and as you know, this space is really complex and complicated. I mean, if you just look there, you'll probably recognise some of your organisations listed there. But it is about how can we all work together across the whole system to try and understand how we navigate and pull this data together and use it. So yeah, quite complex in itself. But really, what we're trying to do is move from, instead of you as an analyst, you know, applying for access to data from one place if you need to, how could we have more of a kind of an approach where it's not one person applying for one data set, but, you know, lots of people can access lots of data sets. So that's the kind of where we're trying to move from, not, you know, this one-to-one relationship, but actually many to many, where it's all in a trusted area, a secure area that people can go in and access. And the NHS Data for R&D program, so the SDEs, is massive here, because what they're trying to do is pull the data together at regional level into a secure environment where people can go in and then they can run their own analysis on that data. So that's the NHS England's data for R&D programme. And of course, we've got two across our region. We've got the East and the West Midlands SDEs that have started to receive data from trusts and local governments on people, and they're trying to link it in the back end so that people can apply to get access to that data. So I'm going to bring it down to the kind of regional level. So we're one of 9 HDR UK funded regions. They're all listed there. And it's about how can we reach out to people within the Midlands, all the different players, important partnerships within the Midlands who work and operate around health data and bring it together so that we can kind of start working more together collaboratively. So the Midlands region, we've got a population of around 11 million people, ethnically diverse, the most ethnically diverse outside of London, which makes our data very rich. Doing analysis on data in the Midlands is like doing analysis on a global scale. I mean, that's the reality. That makes us quite unique, and actually people want to work with us because we've got access to data on a lot of different types of people with a lot of different types of conditions. So, for example, Wales, which is not as diverse as the Midlands, they want to collaborate with us because they've done stuff, but actually it's not. It's probably not representative because obviously their data is limited, so they want to kind of work with us. But yeah, the Midlands region, mix of industrial towns, some beautiful rural countryside, 21 HEIs, so higher education institutes. We've got 11 ICSs, 42 trusts, 5 of which are major trauma centres, and then we have all the other kind of NIHR research kind of systems around that. So the biomedical research centres, the clinical research facilities, the ARCs, CRNs, etc., etc. And the region's got a proud history of doing really brilliant stuff. They talk about this third industrial revolution with the birthplace of the original industrial revolution. So that's the top left Iron Bridge. And then the picture in the middle is the world's oldest working computer that actually was housed in the University of Wolverhampton. It's now at the Computer Museum at Bletchley Park. The picture at the top right is the MR. That was Nottingham, where that was invented. And then obviously huge manufacturing capability across the Midlands, which you can see there, Coventry and motor industry. The DNA fingerprint, that was discovered in Leicester. And the Birmingham Balti, I mean, one of our greatest ever achievements must be. So yeah, we've got a proud history of doing brilliant stuff, and I think we've got an opportunity here to continue doing that with health data. So our regional network has got 3 objectives. We're trying to maintain what we did in QQ1 around those kind of 4 or 5 partners, but actually we want to expand to all parts of our region. So we want to get into Lincolnshire. We want to reach out to Herefordshire, all the parts of our region that was never really part of this journey. So we're trying to really reach out and expand our network. We're all about upskilling and improving the knowledge and capabilities of our people. And that's why we do a lot of things like webinars where we learn from each other. And then maximising opportunities for our region through our regional community platform. So how can we work together? How can we put joint bids in? How can we bring money in? How can we be the test beds for some of this great work? That's kind of what we're trying to do. And 18 months ago, there were 4 pins in this map. And as you can see, we've really tried to expand and reach out to different parts of our region. So the NHS is blue. The green ones are HEIs, so academia, and then the red is local government, because obviously the care kind of side of it and the social care side of it. So yeah, we're really trying to expand our regional HDR UK Midlands network, and it's not all about the big teaching trusts and the red brick Russell Group universities, but what about all the other great things that we've got across our region? Remember, we've got patients, we've got data, we've got analysts, we've got clinicians everywhere. So actually, some of these smaller universities, or the less well-known ones, we're very keen to bring them to the forefront and learn from the great thing that's happening. I mean, it was only when I met some of the guys over, Joe and some of the guys over and Katie over in Lincolnshire, that I learned about the what they've done about linking data across primary care, secondary care, social care, and how they're using that across the ICB for planning. I mean, the stuff what they've done is really, really cool, and nobody kind of knew about that. I mean, you guys probably knew about it, but outside of this kind of this bubble, it's and this is great stuff that we can promote nationally, because every other ICB is trying to do what you guys have done in Lincolnshire, and I think that's where we've got a part to play in HDR UK Midlands, about understanding this and promoting this, and actually pushing you to the forefront so that we can share all the great work that's happening. So we launched our website, and I think that's been really key because it brings a lot of what we do together. A lot of our stuff is all on there. So we've got a community area where people can register themselves and promote what they're doing, and actually link and find other people. So that's a really great thing that we've done. Also, all of our events, news, etc., it's all put on there. So we want people to join the network and be visible. We want you to tell us about your events so we can help promote them. We want to actually do events in partnership. But we also want your good news stories. So whenever you do anything that you think's really, really good, tell us, because we'd love to promote it. We've got a monthly webinar series called the Monthly Data Grand Round. So this is across the whole spectrum of what we call health data science. I see a lot of the analysts up the one end of the spectrum, which is, the kind of application, but, the other end is the kind of tech and the coding and the standards. And so the whole spectrum of health data science, we do talks on. So we have a different topic each month. And if anybody's up for doing a talk, do reach out and let us know. And then we have a quarterly insight sharing webinar. So we kicked this off last year. Our first one was looking at health inequalities and diversity, or lack of diversity across the profession. It was just amazing. I mean, we had 300 people sign up from across the globe. We couldn't believe it. And then we did our next one, which was looking at how we make a difference and how do we use data to improve care. And we worked with Glenn Howard and Andrew Barraclough and other people who you probably know. But we wanted to bring our analysts to the forefront of this webinar and showcase the great work that's happening every day across all of your organisations, and let's use some real examples of projects that you've worked on and some of the dashboards that you've created and all that sort of stuff. So it was brilliant to be able to promote that. And our recent one, obviously AI is really important. So looking at artificial intelligence and how we can use that to improve services across the system. Obviously a lot of that was around the regulation, because this is all up and coming, and people are like, well, how is this regulated? Like, is it safe? How do we know that it's implemented and kind of rolled out across the NHS properly? And we had the regulators there. So your CQC, NICE, HRA and MHRA were all there at that webinar. And we had some really good examples of how AI has really helped and provided that kind of those efficiencies and, increased productivity across the system. So what do? Well, we try and bring different parts of our regional ecosystem together. So we think that we're a network that is operating in this space, and actually nobody else is. So how do you bring, the analysts together? How do you bring the research and the academic partners together? But how can we bring a community together around health data within the Midlands? And actually we'll look at what are the priorities for us as a region, because we might have different priorities as a region. Our geography is different, our landscape's different, but how can we try and pull the data together across the region and then make it useful for the people of our region? We had a conference in Nottingham in June. We brought together, well, it was open to everybody. We were full, so we had a capacity of 150, and we felt that we were actually telling people that they can't come, which was a shame. But yeah, we had a really good event. We kicked it off with the CEO of Nottingham Trust kicking it off, talking about the big problems in Nottingham, saying that, these are the big issues. These are the things that keep me awake at night. These are the big problems across our system. And this is what we think, where we think data can help. So yeah, it was a really great conference. So yeah, we did that. We brought different parts of the system together. So we had presentations from the SDEs, the secure data environments, the BRCs. We also had the CEO for Nottinghamshire ICB talking about sort of more of a system-wide approach and how data really help them with planning and understanding where they need to put the money and stuff. So that was really good. And then we had a final session around learning and capacity building. So yeah, it was really good, good day. We launched the CCIR network. So you probably all work with CCIRs because they're constantly asking you for data. So yeah, it was an idea that came up. Is there a CCIR network across the region? No. Well, shall we just create one? Which involved me ringing round all the NHS trusts saying, who's your CCIR? And by the response was, what's a CCIR? Or who are you? We're not telling you. But we got there in the end. I kept ringing and sending emails and finding out different ways. Obviously, working in the NHS for such a long time, you do know how to connect and how to get through to people. So, but yeah, we set that up. We've got 64 people from 52 NHS organisations, and these are really important people because they're the senior clinicians that are responsible for digital transformation across the NHS, and a lot of digital transformation across the NHS relies on data. So they're a huge, important stakeholder in this journey. Just some metrics since we relaunched. So in the last 18 months, 570 people have signed up. Thanks to everyone on this call who've signed up. If you haven't, I'd encourage you to sign up through our website. We've got 64 organisations involved in our work. Stakeholders is where these are where we differentiate people from the Midlands and those from outside the Midlands. 402 people from outside the Midlands have signed up and they're kind of supporting us externally, but they're not members because you have to be a Midlands person or work in a Midlands organisation to be a Midlands member. But yeah, that's wonderful. We've had 34 events. A lot of these have been online, and people accessing those events is around 1,500 people. And we've produced 72 YouTube videos for people who can't get there so that they can always go and learn afterwards. And that's kind of how our network has started to grow and the number of learning events that we're doing or the people accessing the learning events. So where's it going? This is Everest. We're at base camp. We're not there yet, but I think we've done good to try and establish a regional network around data. There's still a huge amount to do, and it's quite exciting actually. It's a really exciting journey that we're on. Upcoming activities. So we're doing a joint webinar with the strategy unit. So obviously Rachel's been fundamental in helping to plan that, but we're looking at how data might not be helpful, or actually we're calling it a failure parade. How can we learn from failure? Because often you guys are doing projects and sometimes they don't go the way that you expect them to do, and then they just get abandoned. So where's the learning from this? Because obviously we learn about the good stuff because often we promote that but sometimes you get so far with a project and you think, oh, it didn't give me the answer that I wanted, and it just gets abandoned. And then your colleague down the road repeats that same kind of piece of work. So it's kind of looking at how can we share from the negative stuff as well as the positive stuff. We're also planning a webinar with Keel, which will be the one following our next one, which is planned for January. We're looking at an annual conference, and we're looking at doing a potential tech conference this time, and in bringing some of the big global players like Google. She's got links to the Silicon Valley, so it might be that we can attract some of these big techie people to our region. So keep an eye for that. It looks like we might be doing it in Leicester next year. And then PPIE, there's so much to do with the patients and the public. I'm really kind of keen to involve and engage patients and the public as much as we can, because fundamentally it's their data and we're custodians of that. And we need the patients behind us. The patient voice is really powerful. So sometimes when you can't get access, getting patients to say, we need this, we need you to let these analysts have access to this data, because if you do, then they can do some really brilliant stuff. So I think the patients and the public are really important. Just some things that are happening. So HDR UK have launched their gateway. If you've never heard of it, they're mapping all the data sets across the country. So if you're looking for a diabetes data set, you can get onto the gateway. The link's there, and you can look at what's popping up. But it's a way for you to try and understand what data is available. They're not just mapping out data sets. They're also looking at things like scripts and tools. So all those algorithms, the code can be also. So it's a bit of a shop window, really. If you want to look for really cool stuff, they're starting to map that all out. There's a link there. Get on it, play it. Have a play. They've just relaunched that. They're also really keen at, we're also really keen at promoting capacity building. So how can we develop the next generation of data scientists, including analysts? How can we increase diversity across the workforce? How can we support early careers? And CPD, obviously really important. Futures. So this is an online learning platform where you can access mini courses. They've just relaunched that as well. So do have a look, hdruklearn.org. Sign up free. And yeah, if you've got new members, junior analysts, for example, it's a good way that you could get them to sign up and start learning about some of the different things that are happening in the world of data science across the health system. And then the Black Internship Programme. So every year we invite interns to come and work in the world of data science, and they're hosting that across a number of organisations across the country. It's great that some of our Midlands organisations are involved in that and hosting that. So it's a 6-week internship. Because they're trying to improve diversity across the whole workforce. So that's a really good initiative. Practical ways you can get involved. We've got the failure parade, so that's planned for the end of January, and we can put a link in for that. Our next data grand round, so as webinar, Andy Orlowski is doing a talk for us. We managed to convince him to come and talk to us as Midlands HDR UK at the hacker that we had in Telford. And then yeah, join the community. Some of the people on the call are probably up there, but register and promote great work that you guys are all doing, and all of this is through our website. I just wanted to say that we've got a massive opportunity. The NHS is it is the single largest healthcare provider in the world. We've got access to lots of data on lots of different people with lots of different conditions, and if we could pull it together as a country and allow analysts and research access to it, there's a lot we could do to help and transform our NHS and improve people's lives. I think that brings me to the end of my presentation. Thank you.
Thanks, Kev. That was brilliant. You told me to say that, didn't you?
I paid you to say that, actually,
Yeah,
Rachel.
thank you. Did I get it right? No, that was really good. It's funny because you've shared so much information, and so when we first talked about this, because I wasn't familiar with HDR before, when we first talked about it, I was amazed at well, the investment, the opportunity, and just what had been achieved so far, and the aims and everything. And I thought, I think my first thoughts were, well, this can't be true. But it's there is so much that has been done, and I think it's just like the strength and depth of the network as well, and the way it's growing. And I think when you talked about this was certainly filling a gap, and certainly making sure that we're definitely sort of linking those that data, that the aspirations, opportunities to make it much more valuable. So when you're talking through it again, I had like a million questions, and then you say something else, and I have another question. So I'm not going to. So we have a couple of questions on the Menti, but there was a couple of things that just jumped in to my head, and so I wrote them down. And one was related to our last huddle, which was from Ordnance Survey. So they were sharing their mapping products that they had, and the different layers they had on maps, and they're just another opportunity, I think, just to make sure that there are linkages where they could really add value.
Exactly, Rachel. I mean, there are so many opportunities here. There is something called the Health Data UK Health Data Alliance. So
Yes.
all of the data providers are coming together as a group to look at all the different data sources, but it's the kind of high level, so it's it's got the directors sitting on this, but
yes,
they're trying to look at how can we kind of bring down the barriers, because I mean, I don't know, I'm sure a lot of people on this call will agree with me, the technology part is quite easy.
Yeah.
So to link data often is quite easy. I know it just comes with its challenge, but generally from a techie perspective, a lot of what we're trying to do is solvable. A lot of it's around how people understand or interpret legislation. So, the default is no, you can't, when actually, yes, you can. There's a big piece on behavior, like and culture. So it's not always just like the technology solution, like, but it's the kind of people that
Yeah,
can sometimes prevent stuff from happening. I think the other thing is the way the NHS is made up. You know, every part of the NHS is pretty much its own legal entity, so it makes its own decisions on procuring systems. Some building out, some buy stuff off the shelf. You know, if we could work more together, it could increase your buying power and actually and your bargaining power as well, and that we could actually come up with a national solution
yeah.
for where we collect data.
I mean, I'm not an expert, but I do know that the aspiration to link data has been around for many, many, many years, and a lot of money has been sunk into that. And I think it has been sort of established and abandoned several times in terms of sort of a national drive. Obviously, it's where we want to be. And yes, there certainly are the resistance is not necessarily because we don't know how to do it. It's because we don't want to do it, or I feel threatened by this, or I don't think this is just doesn't feel right. The ethics of this doesn't feel right, and so on. So a lot of it will be around the education and sharing of the reasons why and the opportunities that exist when that does happen. So you have your hand up.
I have a question, but before, because this is a really good conversation that you're having, I think from the experiences and talking to places like Scotland and Wales certainly do this as well, because they have more integrated data
Sale,
systems
yeah.
because they tend to work very, very closely with each other, particularly with Scotland. They talked about their data linkage being national, regional, and local. So I think what we tend to do in England is we say we can't link our data because we're talking about our local data sets. But we do need to have that split out because I think your aspiration in HDR UK broadly is the national data sets where we all do similar stuff. But then we will have the really, really useful local, which is by virtue being local. And it's trying to get that balance between the research element, which tends to be national and regional, or the localized, absolutely localized. But one of the data sets that I haven't seen, or even organizations, is mental health. And I was wondering if I just missed that because they tend to be in organisations that, like in Nottinghamshire Healthcare Trust, it's enormous in Nottingham, but you've got Nottingham City Council. So I was looking for all those maps.
Yeah.
And in your senior sort of like director level, they tend to be acute, focused, experienced staff, medics. Have you got mental health? You probably have public health, but mental health as well.
Yeah, I
Those are
mean,
my
as part
two
of
pet
sure.
projects.
So the mental health trust, for example, trusts will be linking into the secure data environment for the SDEs, for example. So there is a plan to move mental health data sets into there. We very much open to mental health people, people who are working in mental health to join our network. The deputy director of the CCIO network is a psychiatrist at the Mental Health Trust. So I mean, we're very open and inclusive when it comes to, you know, mental health data is really important. It's probably sensitive, sometimes more sensitive than some of the other data. So obviously, sometimes there can be more of a reluctance to share that type of data because it is because of those kind of, you know, levels of additional levels of safety and security around it. But yeah, absolutely, mental health data is really important in what HDR UK are trying to do. And actually, some of the big problems that the nation is facing, it relates to mental health conditions. I mean, these are some of the big uh, problems in society, for example. So absolutely, it's a huge data
It's, it's a huge
asset.
cost to the NHS. So it's
Yeah,
always been said by public health it was one of the most expensive, but it's the hardest to sort of count because we don't have QoF or metrics or anything related to it. So they would always say, yes, mental health is like this cost, but we're going to look at these things we can measure in diabetes and heart, and because you've got blood pressure and you've got numbers that you can measure.
yeah,
And it was
yeah.
always very sad. So I think it's the security, but obviously if you can prove your SDEs, your TREs are secure, that's for any kind of data. It's a bit about
Yeah,
how do we understand that? How do we link it?
we had John O'Neill talk. I mean, some of you may have seen John talk at Hacker. He came to do a talk at our data grand round, and he talked about some of the stuff that they're doing with dashboards and what has been developed around mental health data around Birmingham and Solihull. And when he presented to us, I mean, you know, people in Nottingham were saying, "How do we get this?
Yeah.
You know, what you've done there is awesome, but can I see it for Nottingham? And just to have that kind of conversation. I mean, I see it a lot in the world of analysts that where is the place to share all of this? This is one forum obviously for that. But yeah, it was really interesting to see what he'd done, how it's helping, and how they're changing the clinical services based on those dashboards that he's developed. But then other mental health trusts and parts of the region saying, "This is fab. We want it over here in Nottingham," for example.
Thanks, Zoe. Thanks, Kev. So there's a couple of questions on Menti, which we can just go to now. I don't know whether you're logged in, Kevin. You've seen them, but I'll just share my screen
No,
anyway.
thank you.
There's just a couple. But while you're pondering those, and I think one or two of them may have been asked, and you could have covered them during the session.
So data access. I know that you guys often have access to patient level data because that's what you do, and you don't need consent because it's part of what you do as part of your jobs. You're part of the care team, and it's not for research, so therefore it wouldn't need ethical approval and that sort of stuff. I think what would be great is if you guys could not only just do a local project but do a national project, so access the similar sort of equivalent data, but just not in your locality. And I think that's where HDR UK and what they're trying to do with the Alliance to bring down the barriers and to improve access, that you'll not be able to just do a local project for your local commissioners or for your local ICB, but actually you'll be able to do stuff at a national level.
Yeah, and the important part of that is being able to have that sort of comparative information. So sometimes when you do work locally, depending on what it is, obviously, it's very useful to have that context, that broader context. Okay, what else have we got? So thanks, Kev. It's nice to hear. Shout out for links. So good, well done. So then we have how can we connect back to the national team to make sure we're all on the same page?
Well, I think you can use us as that voice from the Midlands. I mean, if there's anything that you think that they're not that could be done, or there's a missed opportunity, or if there's anything that you'd like to promote, or if you want to get more involved, obviously do it through us, because we can be that connecting piece between the kind of national team and our local people. We always try and promote opportunities. So whenever there's an opportunity or a call, or they're inviting analysts to come and present at the national conference, we'll always put that out to you guys. So it's important that you guys sign up so that you get that info and that intel.
And then the last one, I think, has been answered in the one above. So this was you mentioned the linked data, which was between NHS and social care. That was Lincolnshire, wasn't it?
It was Lincolnshire ICB, yeah. Katie Hardwick and Joe Thompson, who's on the call, I saw as well.
Yeah, my friends in links. Yeah, brilliant. I won't stop sharing actually, because I've got one or two more slides. Well, thanks ever so much, Kev, for sharing that with us. We'll have to have an update in a few months, because it feels like there's so much going on, and I've got way too many unanswered questions, and I don't want to give them all to you as homework. So we can do it. We'll do a sort of a Q&A next time. One question I had was I haven't got time to answer, so there we go. I'll leave you thinking, well, what was that question? I'll let you know later.
I think my plea would be for the failure parade. If anybody here on this call has got any, we could. Oh yeah, okay.
Yeah, no, I was absolutely saying. So I'll just come. I'm going to leave 1 minute for that. 1 minute for that extremely important session that's happening in January, which I've just double booked for, but that's fine. I prioritise that, obviously. So our next huddle is introduction to a shiny tool called Complexit, and that's on the 12th of December. There's one. These two are in the wrong order. Stephen Wyatt is going to be talking to us about risk strat and segmentation in January, and Sam Riley is going to come and talk to us about making data count, and there's plenty more after that as well. So, and importantly, as we've just mentioned, I'll say, I think I've got it on here. Yes, I have. So we've got a couple of training opportunities coming up. We have the Fraser strategic decision making, that's in February. These aren't in date order, obviously. Zoe's on the call. Zoe and a colleague Rianne are going to be doing some training, and that's going to be up on the training website, which is part of the strategy unit website. That'll be up there soon. Understanding and Reporting Hospital Mortality Statistics. Now that's Mohammed's course. You can't miss that if you are interested in understanding the how they're composed, how you should use them, and how you shouldn't use them. So that's in December. That's online, and that's one of our free sessions. That's a half-day online training for you there. And then we have the failure parade, which is obviously the most exciting thing on this page. And this is a joint webinar between the Analyst Network and Kevin's HDR Midlands. I've now given you ownership of the entire HRD Midlands there, Kev, so I'm sure you're fine with that. And that is on the 28th of January. I emailed you earlier in the week. I did 2 emails to you this week, and I spread them out by something like 48 hours, which I thought was very, very, very good of me. But this one was inviting your failure stories. So we would like, it's part of the session is just going to be you telling us, which you tried something, it didn't work. It would have been more useful if you could have had an opportunity to share with others how not to do stuff, or you did some research and the hypothesis was this and it didn't. There's so many different examples of stuff we didn't share because we've moved on, because we didn't think people are interested. This is an opportunity to share some of that. I've already had people come back and say they would love to share some stuff with us, and so that's about a 5-10 minute presentation on your part. We then got, so please do get in touch basically with me or Kev. Analytics for Leaders in person, that's on the 28th of Jan. That's my clash, but that's fine. I won't do that. And we have Mohammed is also doing an improvement science 1-day session, and dates for that are coming soon. That's likely to be January as well. So that is it from me. I'll stop sharing, and I will say we've hit 12 o'clock, just over. So thank you again, Kev, for that. It's just fascinating that what you guys are achieving, and there's so much information there. I think we need to sort of sit back and sort of digest what you've achieved so far and what you're planning to do. So thank you for coming, and thank you everybody else for coming too. It's always wonderful to see you, and we'll see you again in a couple of weeks. This is my abrupt end, and I just disappear, and people think how rude, but it's just it's the way it goes. Thanks guys.
Everybody. Cheers.
See you later.